stop the recording.
Testing, testing. Did anything come through?
No. Hello? Yeah, I'm not.
Oh,
either.
you're not even in.
Can you let me in?
There
Yeah.
you are.
Recording in progress.
That came through. Hello?
Yeah. Good afternoon, everyone. It's Wednesday, January 17th, 2024. It's 4:30 p.m. This is the regularly scheduled meeting of the Dubuque County Health Department. We'll begin with roll call. Amy Sunley. Here. Patricia Lemke. Here. Sandra Larson. Here. Preeti Joseph is there. I see her. So we have, we don't have a quorum here in the room, but we have it with her online. Can you hear us, Preeti? You're muted. Not be able to hear it.
No, can you scroll down to see who the other, I think it says 8.
I know Tut's not gonna be here, but I assume Mike will be, so. All right, so we will continue on. We don't have a quorum here in the room, but with Dr. Joseph on Zoom, we do have a quorum of 4. At this time, we'll have public comments. Anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom, state your name and home address. Individual remarks are limited to 3 minutes. Does anybody have their hand up? Seeing none, we'll move on to announcements and updates. I just wanted to announce that Lynn Tut Fuller has been appointed to the Board of Health. He couldn't be here tonight, but he'll be here next month. I met him just before he was appointed, and he's an MD and also has an MBA, and he's a principal in the bank here in town, Capra Bank, I think it's called. And he's looking forward to helping and giving back to the community. So I'm looking forward to his service. We unfortunately lost Adam Hoffman because he had served 1 full term, so he didn't get reappointed. But we got a nice letter from him today on email, and he compliments us and thanks us for serving with us. So just a very nice letter from him. Congratulations to Patricia Lemke for her appointment to a 3-year term on the Board of Health. Ready to roll up your sleeves again?
Yes, so, yeah.
And congratulations to Noah Doherty on his graduation from the University of Iowa. That bachelor's degree in public health is coming into good use here. And we appreciate all the work that you're doing, Noah. And then also congratulations to Tina Daubert on 30 years of service here in the county. That's quite a record. Thank you, Tina. That's all that I have is
And is on.
Anne's on. We're ready for Board of Supervisor, Board of Health Liaison comments. Anne?
Hello, everyone.
Hi.
I don't have, just jumping off one meeting and joining you, I don't have many comments, just of course, always gratitude. And also just wanting to say that Ally did a fantastic job presenting her budget, capital projects. So I think the Board of Supervisors is aware that we want to do some analytics and some, some technology, and of course you need a vehicle. So she did a great job, and I think it's good that, and Sandra, I just got to say, you can introduce me anytime. That was a pretty amazing introduction. I'm sure Ally would agree with that as well. So.
All right. Well, thank you. All right. So on that, Anne, I just wanted to mention, are there ARPA funds still available that could possibly be used for the Department of Health?
Yes, there are ARPA funds still available. That account is not closed. We have not been taking applications. We are using the funds for internal purposes, and you are an internal department.
Okay, just a thought. Thank you. Next, we have the approval of the agenda, but I do have 2 modifications I'd like to make. The variance request, that's an action item number 8. I suggest that we follow number 6, approval of the minutes with that. And the second one, the presentation from the Dubuque VNA Hawkeye Outreach presentation, will follow that, and then we'll go back to the regular agenda. So I make a motion to approve the agenda with those two modifications. Any discussion?
I was gonna make the same suggestions.
Okay, thank you. All right, so, hearing no discussion, then, all those in favor say aye.
Aye.
Aye. Okay, so next we have, approval of the minutes. We have the regularly scheduled Board of Health meeting minutes for December 20th, 2023. Is there a motion to approve?
So moved.
Very good. Any discussion? Hearing none, all those in favor of approving the minutes say aye.
Aye.
Aye. Okay, the minutes are approved. Now we will, have the variance request for 16870 Munce Court. We have a couple of pictures here, and Noah, do you want to give just a little summary of what is being asked for?
Yeah, this is Kevin Karkik here, resides at 16870 Munce Court. He's requesting a 6-foot variance from the dwelling versus this 10-foot setback. It's 4 feet away from a sunroom that was added on after the original home had already been built. So there's no water source in there. It's not a bedroom. It's nothing that would cause any health hazards to anyone in the dwelling. It's Bailey's recommendation that the Board of Health approves the requested variance, as there will be no human health hazards, and the seller will be updating the septic tank to a new one and properly abandoning the existing tank.
And so as I understand it, the normal setback would be 10 feet?
10 feet from the dwelling.
And because there's a sunroom there, we're gonna be 4 feet from the.
Yeah.
And the present tank is 4 feet from the
Yes.
sunroom. And are you just gonna put in a regular system or,
We're just replacing the tank.
okay, all right. Is there a motion? I move that we approve this variance. Is there a second?
I'll second.
Any discussion? It sounds like it's an improvement to me, and I know we would like it farther from the house, but,
Is there no way to put it farther?
So I spoke with the contractor, he came out and actually pumped the tank, did the inspection, and he said, we can't go further away from the sunroom because we'll have to take out the drain field and the distribution box and then redo all of that. We can't go, I would say 45 degrees from where the current is, further into the yard, because the piping from the house would need to be rerouted, and coupling to the existing piping would be difficult for fear that that piping would actually disintegrate when you actually try to work on it. So trying to keep the direct line that's already pre-built in there, pull out the current tank, drop in the new tank, not change any of their other piping. He said that's gonna be your best and safest bet to do this, and anything else is extremely difficult, I would say.
any further discussion? All those in favor of, permitting this variance, say aye. Those opposed? Okay, your variance has been granted.
Thank you very much.
Thank you. Next, I'd like to welcome Lori Martin from the VNA, who's going to give us a presentation tonight on the VNA Hawkeye outreach. Thank you.
Hi, thank you for having me. So I am Lori Martin. As she said, I work with the VNA. I am the Hawkeye Outreach Coordinator, so I took the role over here in October of 2023, but I was previously with the VNA for several years, so this is nothing new. Hawkeye stands for Healthy and Well Kids of Iowa. Just a little bit of background on Hawkeye, in case you don't know what it is. It is offered through the Children's Health Insurance Program, also known as CHIP. It is a free or low-cost health coverage for children and teens age 1 through the age of 18 to the 19th birthday. Once they turn 19, they no longer qualify for Hawkeye. They'll have to go into Medicaid or other insurance options. Eligibility is income-based, so premiums are $0 to $40 per month per child. And no family pays over $40 a month. It is also administered by the Health and Human Services, HHS, formerly known as Department of Human Services, so that is a change that happened. We have plans through our MCOs through Iowa Total Care, WellPoint, formerly known as AmeriGroup. That change happened here in January, just a name change, or Molina. With those, we do have Delta Dental and MCNA. I forgot to add those to the chart there.
Can I ask one question? How about infant to 12 months?
I heard the same thing now.
Yeah, no, no problem. So, infant to 12 month, they prefer to, if they qualify, go on Medicaid, because of all the different visits that they have to do, like the well child exams, the immunizations. They need more coverage, taken care of during that first 12 months, and they view that Medicaid be the best option. Now, note, it's the same MCOs for both Hawkeye and Medicaid. It's just the premium is the difference there.
So your department can help new moms figure out.
Yes.
Okay.
Yep,
Great.
yep. And I talk a little bit about that as we go through. So yes.
Thank you.
No, no problem. So what's covered, this is not an exhaustive list. This is just a general guideline of what we share with families. Doctor visits, eyeglass appointments, dental exams, hospice if they need it, speech therapy, and so on, and also mental health. If a family has a specific question about what's covered, we do, and get them to their MCO with the care coordinators there at the MCO that can answer specific questions. Because some things might require pre-authorization, other things might not, which we wouldn't know every single thing. Go ahead. So this is the Hawkeye and dental coverage income guidelines for 2023. You guys are the first to see it. It just got posted on HHS about a week ago. So it's been a little bit time coming here.
So this is 2023, 2024.
This will be good until April 1st of 2024. April 1st of 2024, we will have a new set of guidelines that'll come out. They're working on them now. I haven't heard anything looking at. Yep. So it's a pretty simple chart. The first column there is the family size. The next column is your Medicaid eligibility. So if they, say for a family two there, make under that 32,000, they'll be put on Medicaid. And then we move into the Hawkeye range. So Hawkeye has higher income guidelines on there. So like I said, a family will never pay more than $40 a month. So for example, I have a family of 5. If I fall under that row 5, all the way towards the end there, where, the very last column, and I make, I don't know, 87,000, I have 3 kids. My cost could be $40 or it could be $20. It will never be more than that $40. So it's per child per month, but no more. So it kind of keeps it nice and concise.
$40 for all 3 kids?
Yes, ma'am.
$40 a piece.
Nope, $40 for the whole family. Yep, so it's kind of nice compared to, those of us who have the private insurance for our families. We can get them on this instead to help bridge that gap and ease in that burden. So that's the main goal of Hawkeye. You can flip the side. So we do offer Hawkeye dental only. This again is the income guidelines for 2023. Again, these will change again in April of this year. But the same process. The only difference with the dental is that, since it's only the dental coverage, it'd be $5 per child, $10 per child, or 15. And again, they have that income limit per child, so it will never be more than the 40. So it's kind of a nice where people, well, we've got the medical cover, but we need help with dental. We can offer that as well. Go ahead. So, I know you guys like stats, enrollment stats. Now I'm gonna preface this. I got this off of HHS. I did ask them if they had stats from July to December of 2023. They do not have them ready, partially because of that unwinding going on, the renewal process, as well as the reorganization of everything coming together and new programs that they're using. So they're working on the stats, they don't have them. But I really wanted to highlight, here in Dubuque County, this is for Hawkeye enrollment. That first row there is continuous enrollment. That means from January to June, that number, those people stayed on enrollment. They never lost enrollment with Hawkeye. Then we have the disenrollment. If you notice, the disenrollment in June, we jumped up really high, and that's partly because of that, the redetermination and that unwinding. It really hit hard, and that's for a couple of reasons. A lot of families moved, didn't update addresses, or they got communication in the mail, but we all get a lot of mail, right? They might have looked at it and tossed it, didn't realize what it was. So then they lost coverage. But then they can also reapply or try again with us as well. And then our newly addition there, if you notice in May, from April to May, it went from 7 to 85 newly enrolled. That would be because those that did turn in their paperwork that were on Medicaid during the pandemic maybe got new jobs, they no longer meet the income guidelines for Medicaid, but they do qualify for Hawkeye. So that's why that number jumped up. I would say, I'd be very confident in saying from July to December, that's probably what we're seeing most of, those same numbers all the way through the months. I know even when I came back on in October, we were doing quite a bit of phone calls on those things, so.
Yeah, it looks to me like you guys are really working hard.
Get calls daily, keeps me busy.
Is that number of continuous enrollment, is that families or children?
That's children,
Children, okay.
children.
And do you know, I don't think you probably do, but do you know how many of these are county rather than Dubuque city?
This is Dubuque County only. They do it by
Okay, so
county.
you don't know the
Yeah,
breakdown?
nope, I don't know that, cause they do it just by those counties, so.
Anecdotally, do you have a percentage that you would maybe think would be county as opposed to city?
I probably don't off the top of my head, just being the new gal, unless you've got something. I would maybe probably pretty high for Dubuque, but we do have a lot of rural area that we're working on covering, so.
Thank you.
Is the Hawkeye, like, I mean, you can really make, $150,000 to get this Hawkeye?
If you're a family of whatever it is on this family of 8,
Family of 8 to do
Oh.
that.
yeah, you
Yeah.
gotta be a family of 8 there, yep.
But the
But
income
it's-
limits are very generous.
For the income of
Yeah.
family of 4, you could make up to $90,000 and still qualify.
Yes.
Seems like there'd be a lot of people out there that could use that don't know about that. you know?
Yep.
I think that was gonna be my question is how do, and sorry to keep interrupting you, but how do people know about this?
I'm gonna get to that.
Okay, all right. Sorry to jump the gun.
No, we welcome questions.
Love the questions. You can go ahead. So just as a reference, this is through the state of Iowa. I pulled this last Friday. I just wanted to highlight, COVID, our numbers for applications across Iowa were, I think it's 217K. And then we kind of dwindled down there. Remember, that's because we didn't have to renew the application, right? Once they're on, they're on. But now back in 2023, we've skyrocketed right back up to where we were, before COVID. So, we're seeing a big increase.
Well, in 8K in 2 weeks of January?
And I was just gonna
Phenomenal.
say, that was Friday that I pulled this to get this together, and I looked yesterday and I was already at 10K
Wow.
across the state, so.
Yeah, but that's
Yes.
phenomenal.
It's huge, and, we're kind of that orange yellowish line there, you can see quite a difference. If you go to the next slide, it'll show, between 2022 and 2023, quite a difference because of that unwinding. So this is a very big deal. It's huge. And we are seeing the aftermath of it, of the unwinding and families not realizing, wait a minute, I haven't had to do anything for 3 years. Why do I have to do this now? And losing coverage and not really realizing it until they go to the doctor and the doctor says, well, pay this or you don't come kind of thing. So you can go ahead and hit the next one. This is medical coverage by group. I just wanted to show you over the state of Iowa, we have 62,725 children on Hawkeye across Iowa. And then on the next slide, I went specifically in Dubuque County, since that's where we live. So over Dubuque County, we have 17,000 members there, almost 18,000. That is all medical assistance. So that's Medicaid, Iowa Health and Wellness, long-term care facilities, as well as Hawkeye. Hawkeye, for children is about 1.4K of that number. But as you can see how many children are already enrolled, and just like you guys talked about, there are many families out there in Dubuque County that I feel would highly qualify for this program. So that's kind of where we're at with outreach and stuff. So I'm gonna talk about what we're doing for that process. You can hit the next slide.
Is this the kind of insurance, like if family gets it, they don't have any deductible, or is there a deductible?
There's no deductible.
It's just the max 40.
Yeah, they might have a
month.
premium and
That's it.
that's it, yes.
And do you have a list of providers who take?
Yes.
I know
Yes,
you're
we
probably
do.
getting to that, but.
And we share that list publicly. We'll
Yes.
email it to resources. So if the Board of Health ever wanted it, we could provide a
Yeah,
copy.
it would just be another good thing to have on our website,
Yeah.
probably.
I just updated that resource in, I think, December. So,
It's a
yes.
pretty large, I mean, they're quite a.
For
few that
medical
take-
care, yeah. Dental care is a whole nother story, but we do maintain a dental
Yes.
list of
providers who accept.
I think our iSmile coordinator is
Does that.
is gonna work on that.
And is
too.
currently working on updating it for 2020.
And with the dental, I said we have Delta Dental and MCNA. Well, surprise, we have a new one coming in the summer and MCNA is going away. So now we'll have Delta Dental and DentaQuest,
Mhm.
I think is the two. So there's a whole nother change happening again, which will affect Hawkeye and all those members as well. So what are we doing? At the VNA, we can do what's called presumptive eligibility. So this is on the MPEP system, that this is a online system that as a qualified entity, I can log into, I can enter your information, and I will get a same day approval or denial for temporary Medicaid coverage. That'll cover medical and dental while they process your ongoing applications. So you remember all those kiddos that go to the doctor and go, oh no, what do I do? They can contact us. We can do one presumptive per calendar, like the year. So if I do one today for you, I can't do it again until next year, tomorrow kind of thing. But we can do that presumptive, get them started. And while they process that ongoing application, they have some coverage. So they can be seen, they can get their prescriptions, they can go do stuff. The trick is getting to the doctor that understands what a presumptive is. So we have a few of those kind of in our back pocket that we use a lot of. So they understand the process in there and they can get paid. We have 5 staff members currently that are able to help with this. 2 of them are out in our outer counties that we serve. I try to travel as much as I can, but we all know winter weather is gonna happen. Here in town, we have 3 currently that we serve the families and children that come in. Typically in a month, since I started, we've seen upwards of 18 to 20 applications. So 15 to 20 families are coming in for this presumptive eligibility. And we can put everybody on there and do it. That's kind of what our numbers are showing there. This is the number of children that we've been approved for presumptive eligibility that have gotten that temporary Medicaid and then moved on to either getting that insurance or denial or whatever it is. With presumptive eligibility, if I do it today, it is good until the end of February, unless Medicaid says on February 10th per se, we've already approved you, here's your MCO, presumptive eligibility ends, and now they have an MCO. Or, sorry, you're denied, you make too much money, now you don't have anything again. That kind of thing. So it's kind of a day-to-day basis, but at least gets them started to get them going. And we do follow up with our families as they go. So every couple of weeks we check in, that kind of thing. Because when they do the application, it goes to one person at state. One person looks at it for Medicaid, then Hawkeye Dental only. So one person is looking at one application, one person, and how many people they're applying. It takes time. So an application can take anywhere from 45 to 60 days.
So on the day it's denied, are they done with coverage then?
They usually get a letter that states that your coverage has ended, yeah. So if they decide on February 10th that they're not eligible, they usually give them like a 2-week window kind of thing, but they get a letter in the mail saying it ends on XYZ.
So you said you traveled throughout the county.
Yeah.
So like you could set up in Farley Library or
Absolutely.
Cascade Library and
Yes,
do some applications there. They wouldn't necessarily have to come into Dubuque.
nope. Nope, and we can also mail them the application, they can mail it back to me, we can do it that way. We do that a lot of that. So on the next slide. So VNA and our outreach community partnerships. So with the community partnerships, I go out to different places. Like I just met with Unified last week, Unified Therapy, and they're willing to let me come sit in their little conference room and let families come to me and do the application. The
Where's
big
that?
Unified Therapy out here in Pennsylvania.
Okay.
And they also have a location down Crescent at Elm Street, yes. So, and we work closely with Crescent as well. So we get a lot of that back and forth. Clarity Clinic, I've gone there and sat there and done it with them, especially with our non-English speaking families. That's a really high population. So we do, when we have them in person, we gotta get it and get it taken care of and get it done. We do have our Marshallese connector as well, who helps with the presumptives for the Marshallese families. So we are out there. We get a lot of referrals from those community partnerships and outreach. That's where our Hawkeye outreach numbers, we have to keep track every month of what's going on. So we go to businesses, faith-based communities, schools. I met with the school counselors here in Dubuque, gave them my information, and I think I've had 5 different families come to me now since November and gotten assistance.
Since November, wow.
Yes, at 2 of them were this month already too. We've had it by word of mouth. I've helped one family tells another family and so on. So WIC is the other one we get a lot of referrals from, but that's also because it's in-house for us. But
Are you the only organization in the county that does this,
the presumptive eligibility,
applications and stuff?
I don't think so.
No, I think, so Angela Pesci at Crescent, their department, they do a lot with insurance. We typically work hand in hand with her, so if it's a same day presumptive and it's a child, we'll work together. She'll usually send down, cause she does a lot with adults
Adult.
too, but we partner with her super close. Both hospitals used to have a person in like their billing, but it was primarily used for patients there. Like if a patient presented,
Like a 3-day emergency.
yeah, like in an emergency situation.
Mhm.
But again, we have partnerships with our hospitals and our other medical offices. So
Yes.
if they were to get a phone call, they will refer to us, and they historically have referred to us for that service. Mercy Maternal Health is another one. We work very closely with them. So if they have ones that need to be filled out, they'll notify us right away, send it via fax, we'll enter it into the computer with them. So there's a lot of partnership and collaboration going on because it takes a
Yeah.
village.
Yep.
And we're happy to be a part of that work.
Yep.
Do you know, like, if a family applied and they have a job and they have insurance, but it's a high deductible or something, does that make them ineligible?
It's all based on income.
Okay.
So the one thing with Hawkeye is they can maintain, so if they get approved for Hawkeye, they cannot maintain that private insurance. They cannot have both.
Yeah.
If it's Medicaid, they can have both. That's fine. If they want an extra dental plan, they can have a private dental with Hawkeye. That's okay. We just can't have the private medical.
Yeah, but like,
So if you have a family who's struggling, you know, like say a family of 4 on mom's insurance and they're struggling to pay those, the
Yes.
kids could come off the insurance and come to Hawkeye.
yeah,
if
so it
they need-
reduces the premium
yeah,
cost
yeah.
Yeah.
for the parent. You know, being able to go from a
Right.
family plan to just an employee or employee spouse, however that looks, and then they can have their children on Hawkeye.
Now, what would happen if, heaven forbid, there was like a serious illness and they had to go to Iowa City or, I mean, does that, I mean, will it still pay if there's, like say,
Hawkeye?
that- yeah, like say they had to go to Iowa City, they were hospitalized for a month or something, so
Mhm.
it,
It's through the whole
covers.
state of Iowa. Yep. Yes, they can go
and
to Iowa
there's
City.
specialists somewhere that, like in Iowa City, that,
Yep, and that's where we would recommend they talk with the MCO of what specialists are in their network and those kinds of things, so that the service will be covered.
oh,
So,
so it
MCO is
follows
what?
their MCO.
Mhm.
Okay.
Just like
okay.
Medicaid would.
yeah,
What is MCO?
a managed care organization, so like Iowa Total Care, WellPoint, and Molina, the medical piece.
And the nice thing is the application she was talking about, so say a family fills that out and they are over income from Medicaid but qualify for Hawkeye, they don't have to do a whole nother application for Hawkeye.
Nope,
It's the
the same.
same application, no matter if you're applying to be Hawkeye or Medicaid.
Okay.
Same application, one-stop shop, it gets submitted, the state determines based on your income which one you fall to. So it makes that easier for families as well.
And if they don't agree with the determination, say they get denied, they can do an appeal. And I've seen a few times where people have appealed and but, wait, no, my income is not this because of, I don't get overtime or I've lost out,
Or like seasonal employment.
seasonal employee, all that kind of stuff. So, they can do that. They just have to do it within a certain window. I think it's like 30 to 45 days, I think is on the application. So we've helped with a few families of that too, where they've brought me the denial and went, oh no, and then we've gathered the information together and I'll help them fax it, send it up, get it up in the forum and that kind of thing. So really, we do a lot in the community. I am out and about 90% of my time,
Mhm.
more than likely. I try to be at our site for people as well, but I like to be out and about. Interagency meetings, we go there and meet with people. I've reached out to a few businesses. We met at John Deere in November and October for their health and wellness fair. There we saw over 2,000 people come through, information gathered, taken out, all of that. They post things in their break rooms for us. We did Unity Point Health, all of that. So we do a lot of health fairs and meet the families where they're at. A big one we're doing is out in Western Dubuque here on February 3rd. I think it's Happy and Healthy Days, I think is what it's called. But it's for families out there and it's being shared. And so we will be there as a VNA to help. And even at those events, we can do an update. We have
That's
them
at
with
the
us.
school, correct?
Yeah, yep. Yep, so we are out there, we are out and about, we try to be busy, busy, busy all the time. But yeah, the main goal I have, is to get to more businesses, to share this information, cause like you said, I agree, I think there's a ton more families out there that could be,
Especially like McDonald's and
Yeah.
those
Yep.
places that have like almost minimum wage and stuff, you know?
yes, yep. And I do try to go in person as much as I can, but I do mailings, to try and get mass information out and then follow up with phone calls and that kind of thing. Each month I'm required to meet with at least 12 entities, but as you can imagine, I meet way more than that every single month. So
Do you cover more than Dubuque County?
I do.
Oh, okay.
We have 8 counties in total, all the way up to Alameda, Chickasaw, Howard, all that. Yep. Yep, that's why it's one of those to kind of spread as much as we can, but that, we have a lot of staff that know about
And
it.
there's two different, like your Board of Health up there talks to you about those, like in Clayton County, and like we'll
Yep.
talk to you about Dubuque County's.
Yes.
Hawkeye.
Yep, and I'll be going throughout the year to the different Board of Health, just like this, to share specific information, so I'll take Dubuque County out and put in whatever county we're at. But yeah,
The Western Dubuque thing is when?
February 3rd.
Okay. During the day?
I think it's a Saturday, so it's like a 12 to 3, I think.
So it's sort of like a health fair.
It is the health fair, yes. Yep, I think they're gonna have like a panel board discussion for like a half hour, and then there's resource tables available for families to come around. So we'll have like a game for the kids and that kind of thing.
Do you have a graphic for that, a poster?
I don't, but I do at my computer.
That's perfect. I wonder if you could send it to Noah, and then Noah, you or
Absolutely.
Tina could put it on the Facebook page.
Certainly.
Brunio, write it down, so then she'll remind me to do that. Right.
That way neither one of us will forget.
Thank you.
Yeah, so with that, and to try and catch families too, one thing that we do is we have insured children that have child exams that might be coming due. We've given them a service in the past year and they show up every month that they're due, and we try to either call them or email them, not email, I guess, mail information about Hawkeye, reach out to them, do you have questions, you're due for a child exam, you're due for a dental exam, all those kinds of things. So we are certainly trying to reach in every possible way, but obviously, there's one of me and a lot of them. So I do rely heavily on the partnerships to help and get the information out, but yeah.
Are you getting into childcare centers?
Yep, I work closely with our, Kelsey,
Childcare nurse consultant.
that's the name. I work closely with her, so she takes my information there as well, especially those ones that are like in-home providers, and the bigger ones. I've worked with Deb Gustafson. Actually, we used to work for her, so she is a very good partner as well to share information and post our stuff at their center. Yeah.
Do you have any ideas, like right off the top of your head, about how the health department could partner with you to assist with this? Any?
I would say if you guys have social media or anything like that, or you're posting anything, if you're willing to post the income guidelines or just a brief blurb of what Hawkeye is and my information, that would be honestly,
Yeah.
that would be a big one. Social media is something that we're supposed to do, but obviously with Unity Point, if we post on our stuff, it's a little more, I guess, picky.
We don't have a VNA page. We're part of Unity Point Health Dubuque, so it filters
So I'm
for them,
limited.
and they really post for us a lot, but, yeah, the more information we can
Yes,
get out.
yeah.
Well, we have a Facebook page. Noah, do you have a card that you could give them with
Yeah,
your
yeah.
email?
Perfect, even if you just want the link on your website.
Yeah.
Right, and we have a website
Absolutely.
that we could do that. I think we're trying to maybe hopefully start Instagram.
Yep.
So
Yeah, absolutely, that would be
those,
great.
I mean, that's coming, but we do have Facebook
Oh,
now.
no, that's perfect.
And
Yeah.
we do have our website that hopefully we could put
Yes,
links on, since we
yes.
do partner so heavily with VNA, it would be great
Yes,
to.
and in December, we were across the state, we had still 400,000 families left to go through this unwinding process. And once those guys get through, guess what? We're starting all over again. So you know, uphill climb to keep everybody and that kind of thing. So yeah, if you guys can post things about that, or if you know of any businesses that need anything, or people that would like a presentation even of what we do, 5-10 minutes. I've done lunch and learns as well, so that's pretty much.
I think your outreach in the community, and the outside of Dubuque is really good too. I mean, it sounds like you do a lot of that too.
Yes,
Yeah.
yep. We've been up to a couple of public libraries, so it's been fun.
That's great.
Yeah.
Great. Well, thank you, Lori. Any other questions for Lori tonight? Thank you for
Very
the
informative.
presentation.
Thank you.
That was
Thank you.
Something I didn't know anything about, so
Okay.
thank you.
I will tell you.
I've gotten a couple calls from the hospital.
Yeah, that's great. Thanks, Lori.
Yep.
Okay, we'll return now to the regular order of the agenda, and we have some consent items, just in that, the Dubuque County Public Health Department monthly report by Ally White is received and filed. Did, anybody have any questions about her report? Ally is in Des Moines this week. She's at a leadership conference. So she couldn't be, well, she's on with us,
I'm
I
here.
think. Hi.
I'm here. Hi, guys.
You're just being silent.
I am being silent.
Is there anything you
Am
want
I-
to tell us?
No, but ask away if you have questions.
I don't think I had any questions.
Perfect. Well, I counted 97 cars in the ditch on the way here, so everyone can be glad they're safe and sound at home.
Yeah, how long are you gonna be down there?
I come home tomorrow. Today's speaker was really good too. I'll bring some interesting stuff back to share, so.
Okay, and did you drive the department car?
I did. She did good.
Good, very good. Okay, well, thank you. Just pipe up if you've got anything to say, Ally. Okay, next we have, did you want to give a report, Brittany, or?
I see that Stacy did the receive and file. I can answer any questions you might have about her report, if
Okay.
you had any. I don't have any additional things to add to it.
Stacy couldn't be here either because she had surgery yesterday,
Yeah.
I think, so.
Everything went well. She's resting at
Good,
home.
yeah. So, no, I don't think so. So, I mean, I think you guys are keeping busy there at the VNA and doing a lot of outreach, and we appreciate that.
And if you guys hear of any like outreach opportunities or events in the community or the county, send them our way too, because that's really the bread and butter of what we do. We want to get out there, so please let us know if there's anything upcoming.
I'm hoping maybe on February 3rd, we can have someone from the health department at the health fair at Western Dubuque. But we'll see how that goes. All right, any questions about the VNA's report? Hearing none, then we'll just receive that and file it. There's also an opioid settlement funds monthly report by Carissa Brown, the public health project coordinator, and she's unfortunately out sick also.
She is on though.
Hi, Carissa, is there anything you want to tell us?
Yeah, I could share out on the report if
Yeah.
you want to go to it, Noah. And hello, everyone.
Hi, hope you're feeling okay.
Thank you. I'm doing pretty good so far, so I appreciate that. So I just kind of put this, if we're good to go, I can share out real quick.
Uh-huh.
Just kind of like a page together of what I've been working on so far in these past 2 months. I know a handful of you who are here today have heard some of these things before in the opioid subcommittee meetings or in general, but for those of you on the Board of Health who haven't, it's great to share out and kind of let you know what I've been up to in my time so far. So a few things, I broke this down, just letting you know, meetings, a handful of my time has just kind of been able, getting out in the community and meeting people, especially those who are working firsthand, boots on the ground, who are really involved in this type of work. So today I even had a meeting with Scott Simpson from ASAC, who is our Dubuque Care Navigator. And then I've met Cassandra from ASAC. The list goes on. You can read there the Drug Task Force, Hillcrest, Drug Court Coordinator, Jail Diversion Coordinator, and there's always more people to meet. So I'll probably continue doing that until the end of time because there are always more people to learn from and get their knowledge on things. So I will continue to do that. And if there is ever a time where you think of someone else who would be really helpful, I'm happy to always take recommendations. I'm happy to meet with anyone anytime. Other things are just research. A lot of the work has already been done by other universities creating and studying and sharing evidence-based practices that work and that have been implemented. So learning that, studying those, figuring out what could work best for our county specifically. One of them is Johns Hopkins. Other things are, I don't know if you guys have heard of, there's a Hulu series called Dope Sick. There's this woman, she wrote a book, and she kind of shared her experience talking firsthand with people who deal with OUD. And so I got to watch a webinar where she shared her experience writing that book and creating that series. And then other webinars as well, continue to be a part of those. And then for overall continued work in general, a big part is resource mapping to understand the access and what it's like to receive access in Dubuque County, and using that information to help complete our website that will hopefully be up and running here in the next, few months. I would say right now it's about 60% complete. There is locations pinned on there, but they're just missing like key information. And so finding all these different pieces like the website link or the hours or the days they're available, and finding all that stuff and getting it put into that database. Other continuing work is working with the Drug Task Force for finding data on different things related to opioid use disorder, whether it's overdoses where they have happened, any unfortunate deaths due to overdose. And also in our opioid subcommittee meeting recently, we talked about TrueNarc, which is a device that could be used by different law enforcement agencies to help detect things like fentanyl without them having to physically touch or physically open anything, so keeping from being exposed to that drug. Another exciting thing with the Drug Task Force coming up is next week. They are, I believe, the ones hosting, but there are a lot of different organizations coming together to learn about OD Map, which will be a platform where everyone should be able to share the information that they have in regards to overdoses in the county. So the hospitals could share their information using OD Map, the Drug Task Force, harm reduction advocates, whatever they know. This should be hopefully a platform that can centralize all that data and so things are a little bit more accurate. And then forming a more targeted opioid response team to pick up where there was a group called the Opioid Response Team that met monthly before COVID, and it kind of dropped off. So I've learned after that. And so the hopes is to build that back up into a working group. I've been working with Melissa Springer and Courtney Rundy, and I've been in contact with them to learn more about what that group looked like. Also, Diane Heinken, sorry if I mispronounced her last name, but figuring out kind of where that group was and where it can pick up from now. And then using evidence-based research again to share knowledge from key players to form a plan for how to spend money in the short term and long term. So when I'm meeting with people, one of the key, like the reoccurring things I ask everyone is, if you had an unlimited amount of money, what would something that you think would be really effective in the short term and long term to implement in our county, whether there is a gap they notice or just something that could be helpful that might not be fulfilled right now. And then lastly, I put on here is to work with the Opioid Response Network on strategic planning. I have made contact and reached out to them, and they were very responsive. They have different strategic plans from other communities to share with me, so we could possibly take note from what is already happening, but also willing to work with me and really anyone to build our own strategic plan to be more catered towards our county. So I'm really excited to work with them on that, and it is completely free.
Great.
Noah, can you let Carla into the waiting room?
Thank you, Carissa. Did you see the request that the opioid subcommittee meetings meet
I hope at this next opioid subcommittee on just a confirmed reoccurring date, like we talked about at this last one.
Sure, yeah. Okay.
We could make it later on. Yeah.
Thank you very much.
Carissa, who did you say you were working with on that OD map?
Adam Williams, I believe is his last name, from the drug task force invited me to come to, they're hosting an OD map presentation, I believe. He's been in contact with a representative from there. And so he's the main one, but I believe he's invited like the sheriff, chief deputy, the police department, and a handful of other organizations to come to that presentation. I don't know all of them off the top of my head.
That's okay. I just missed who you said was running that.
Oh, yes, sorry.
Any other questions for Carissa? Okay, well, thank you very much for your report, and I hope you feel better soon.
Thank you.
Response to public questions. Did anyone get any public questions this month? I didn't really, so. Hearing none, then we'll go on to unfinished business. The strategic plan was pushed over to February because we knew that we were gonna have a light attendance here, meaning that Ally was gone and Bailey was gonna be gone. Bailey is gone. She had to go out of town. So we put that over to February, so we'll have a work session at our February meeting to drill down and take a close look at that draft. New business, is there a report by the nominating committee as far as who is willing to run for office this year?
Is there a report? Yeah. Well, I think that, we did meet and, Sandra has agreed to stay on as our chairperson for, this coming year. And, Amy offered to continue as the vice chairperson. And, then Sandra was requesting that we had a secretary to at least help approve the minutes and in draft any correspondences. And I did offer to take that role. So those are the three candidates that we have.
Do you want to make a motion for unanimous consent?
Don't we have to vote?
Well,
I can make a motion.
you can make
Oh,
that
I can
motion.
make a motion for unanimous consent for those three people.
Is there a second to that? Any discussion? Hearing no further discussion.
Her name's not on the list this year.
Good to be that secretary, I promise you that.
Okay, so all those in favor of that slate of officers, say aye.
Aye.
Those opposed? Hearing no opposition, then we are the lucky ones, guys, so. Sandra Larson will be chairperson, Amy Crow Sunleaf will be vice chair, and Patricia Lemkiel will be secretary. We'll still continue to do the minutes as we have, but you can send them to Patricia first. Yep, thank you. Okay, let's see, board communication and reports. Do any board members have anything they'd like to share tonight? Hearing none, then we will go on to our next meeting will be February 21st, 2024 at 4:30 p.m. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand on Zoom, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Does anyone have anything they'd like to talk about? Seeing no hands raised, is there a motion to adjourn?
Second.
Okay, we're adjourned. Okay, very good, thank you. Was there a hand?
No, I asked you to scroll down, yeah, so then.
I just wanted to say too, at this meeting,